When a couple shows up in my office for evaluation of infertility, I tell them I have a very easy job because it only takes 3 things to get pregnant. To get pregnant, you need first an egg, second a sperm, and third a path between them. To evaluate the egg, we can check that by a series of lab tests. We can get labs on the 3rd day of her menstrual cycle and on the 21st day of her menstrual cycle. To evaluate the sperm, we can check a semen analysis. That's a very easy, low risk, and inexpensive test to assess whether or not he is making sperm. To check the path between them, we can do that with a combination of ultrasound and a test called a hysterosalpingogram, or HSG, which is commonly known as the dye test, where we inject some dye into her uterus and then hopefully under X-ray watch it come out her tubes. Causes for female infertility depend on the population you're looking at, but here in Richmond, Virginia, most common causes we see are lack of ovulation or anovulatory infertility, where she does not release an egg each month, and most commonly that's due to polycystic ovary syndrome. Other common causes in the female are blocked tubes, which can be due to intentionally blocking the tubes from a prior tubal sterilization, could be due to a prior infection, diseases like endometriosis, or it could just be unexplained tubal obstruction. And third most common is unexplained, where we can't find a problem with either the male or the female. The most common cause of male factor infertility is unexplained or idiopathic. Low sperm counts are most likely unexplained, but no sperm usually has a cause. If a man has no sperm, we do some additional evaluation, including assessment of his hormone levels, as well as assessment of his pathway. The 9109 building is a new construction. It's in the Stony Point area and pretty centrally located in the Richmond metropolitan area, so it's easy to get to from anywhere. Everything we need for treating infertility is right here in the same suite, in the same facility, so we can handle all the procedures and everything right here under the same umbrella. So patients don't have to drive across town to have one procedure done one place and then come back to have another procedure done here. We can do everything in-house. Most common question is why? Why are we having trouble getting pregnant? Most of the time we're able to answer that. We can find a cause, or sometimes multiple causes, that they're having trouble conceiving. In about 15% of the cases, though, we're not able to find any cause, and those are the couples with unexplained infertility. I always tell them, though, that unexplained doesn't mean untreatable. So even if we can't find a cause, there are good treatment options for unexplained infertility. I think the majority of people who come to see me will eventually end up pregnant. It's just a matter of what we have to do to get them to that point.